for us to talk about the Life Care Specialist program. So can you tell us, well, what exactly is this program and what do life care specialists do?
Life care specialists create a barrier that prevents pain management at the hospital from becoming a drug addiction at home. I like to start with that because, we need a human being, a person that is a part of the health team. So, working with the health team at the hospital, with the doctors, with the nurses, as you know, doctors, physicians, and nurses are extremely busy and they don't have the time to be at the patient bedside to work out a pain management plan, to educate the patients about the medication that they're being given, making them aware you are on an opiate, you're going to be going home with an opiate, we're going to follow you when you're discharged from the hospital. Um, so that's number one. Then the second part of it is using the community resilience model to work with these patients around anxiety, stress, depression, PTSD. And, the Grady Hospital health team, they're great at fixing the issue if there's a gunshot or a surgery, right? But the patient's been through a traumatic experience. So the life care specialist is there to help them with what happened. And we use the community resilience model and the skills that are so easy, so adaptable for any age, for any literacy level, that can be taught quickly and effectively. And
So,
so,
so if you can help me, like, I
keep
know that
going.
I've met some of your wonderful life care specialists, and so maybe take us through what do they do. So, how do they get the referral in the hospital? Because I know that one of your missions is you'd like to see life care specialists in every hospital, not only in the United States but in the world, so that we could start, more prevention strategies. So, can you tell us a little bit, step by step, what they do? How do they know where to go? Um, is and when they do go and meet the patient, how do they get the patient engaged that the patient might even want to listen to them? Can you give us some examples?
So we've been in the hospital, we've been at Grady for about a year now, and we've seen over 100 patients. In May, we're going to be starting a trial, meaning that there'll be a control group of people that get the life care specialist and a control group of patients that don't have, and you have to compare the data. I do want to mention that this trial is registered on clinicaltrials.gov. I mean, it is a true research project through Emory. And we do a risk assessment with the patients. And it's a survey of questions. And we have to ask the patient if they're willing to be a part of the program. And most do. They want somebody. They When you say life care, you're talking about my life care. Yes, I want to be a part of that. But it does require a lot of questions, and they can be personal questions. But we have to go through that due diligence to understand and do an assessment so that we can provide them the right techniques and tool set that we believe that they need after the assessment's done.
And so when you finish the assessment, then they create a plan of intervention with each particular patient that they meet. And I know that you were
Right.
sharing with me that as hard as the pandemic has been for all of us, there was also a silver lining that happened in terms of the implementation of the life care specialist program. So can you tell us a little bit about that?
Yes, thank you for asking, Elaine. We obviously, when we started this program at Grady, we had no idea COVID was coming, right?
Right.
And we were able to stay on the floor during COVID. And think about this. For example, we had a patient that she was 26 years old and she had her leg amputated. She had nobody to come see her. She couldn't have her mother, she couldn't have her father. And so, if it hadn't been for the life care specialist to be able to be at the bedside and to check, and the life care specialist over the duration of a patient's stay at the hospital gets very close relationship. There's sometimes 5, 6 hours total they've spent with that person. And so during COVID, I really feel that it just uplifted the position, became so much more important. And as we all know, since COVID, look how mental wellness is such important two words in our vocabulary that really nobody talked about before. and we didn't discuss the anxieties that we have on a day-to-day basis. Now it's okay. Everybody's like, it's a freedom now all of a sudden to say, let's talk about mental wellness. And our life care specialists are there to provide that mental wellness piece, those techniques and those tools through the CREM model. Honestly, that's what we use.
Well, I just love that you use CRIM. And for